Hello, folks. I'm Dr. Fazil. You're watching 2024 August episode of Dr. Fazil TV show. The topic of discussion today is growth on the kidney. We call it cyst of the kidney, and again, we can call it cyst of kidney, but let's talk about that, right? So folks, the reason I picked up this topic is because a lot of people do, we find out cyst on their kidney. Sometimes it's incidental, that when we do a imaging study, for example, ultrasound or sonogram, for whatever reason, and then we found cyst on the kidney, and then we get involved and the patient have questions that if the cyst is, oh, by the way, I'm also a kidney specialist, so I just want to let you know. So this is my specialization, right? So cyst on the kidney is actually pretty common, and we get more and more cysts on the kidneys with the time. Now remember, there are two kinds of cysts in the kidney. One is genetic. We call it polycystic kidney disease, and there are two kinds in polycystic kidney disease, type 1 and type 2. Type 1 is more worse, type 2 is not that as bad. We're not talking about those problems at this time because that's another topic by itself. So I need another session to just discuss about polycystic kidney disease. But again, I give you a little information. So in a polycystic kidney disease is one of the very common genetic kidney disease. Type 1 kidney disease is where there's and you can see this hologram right here. You can see this is a kidney. It's a normal kidney. Let's have it replaced with another hologram. And you can see this cyst has all kind of cyst on it. It looks like a grapes on the cyst, grapes on the kidney. And we call it polycystic kidney. And this is a genetic condition where people, over a period of time, very rapidly, the whole kidney is replaced by the cyst, and it destroys the kidney. And it presents with pain, blood in the urine, abnormal kidney function, and then also blood in the urine, and then high blood pressure, right? And there's new treatment available now, which can slow down the formation of cysts, but most patients in the very early age end up in having end-stage renal disease. That means the kidney function is less than 15%, and then they end up on hemodialysis or kidney dialysis or peritoneal dialysis. So type 2 is happen slowly. So generally you see in a later, middle age, or is diagnosed in middle age and above when the cysts are formed. And if you do a sonogram for whatever reason, you will see cysts on the kidneys, and there are multiple cysts, and then we typically type 2, and it's also genetic. Most of the time, these patients don't have bad enough kidney function to end up on dialysis, so they can, if they are treated properly, those could be maintained. The kidney function could be maintained, and they can live a normal life with some medications, right? So now let's talk about like other common kind of cysts. We call it simple cysts. So let's have this hologram go away, and I'm going to bring another hologram right here. Right here, this is the kidney, and you can see a little swelling on the kidney. We call it a cyst. It comes in two flavors. I call it two flavors. One is simple cyst. A simple cyst is like a kind of like have walls, like thin walls. It might have fluid inside, but has no septation, no walls inside. Like this is not like a honeycomb kind of situation. So generally they are benign. So we don't really do anything about it. I mean, they tend to cause not any problems. They are benign. You don't get any pain. Sometimes they can get infected, and then you need to drain them, but they come right back. Very rarely you can have bleeding inside a cyst. So hemorrhage, infection, and if they're very painful, too big, then you drain it. But again, as I said, mostly they come back, so we generally don't do anything about it. The other kind is complex cyst. The complex cyst is where you can see a picture on the back. Let's have this hologram go away. You can see the picture on my back side on the screen. This cysts have walls, septation inside. It's like a honeycomb kind of configuration, and they have different categories. I mean, category 1 to 5, and based on that, we can see if it is what is the risk factor. It will change into cancer, but the risk is not zero. So you need to follow up them periodically with the sonogram and then make sure they don't change into a situation where they need to be taken out. And if you're not sure they need to be taken out or need a biopsy, by a surgeon or by intervention radiologist to make sure they're not precancerous or cancerous. And if you see a mass, on the kidney, most likely that's a cancer. So obviously the mass, a cyst, a simple cyst, a complex cyst, and complex cyst can lead change to mass, and mass is most likely a tumor or renal cell cancer. And fortunately, we're diagnosing them very early in their lifespan because we do imaging for some other things, for example, abdominal pain, for other reason, and we do find a cyst on the or mass on the kidney, which is not causing any problem yet. And if doctor is vigilant, they will let the patient know. Then we jump on it. We'll take the cyst out, or have them go to a surgeon, have them take the cyst out. Obviously, that has to be done by a surgeon, or is a surgical procedure, right? It's a simple procedure, but if it is done timely fashion, we can prevent the spread of the kidney tumor. Sometimes they have to take the full kidney if it's spread inside the kidney, or sometimes they have to just take the portion of the kidney. But even if they take the full kidney, your kidney function will remain the same. The second kidney is become hypertrophic after you remove one kidney, and people can have a normal life. So they don't really need to worry too much about it. So obviously, if you have a tumor on the one kidney, you have a high risk to have a tumor on the second kidney also down the stream. So we need to be vigilant and need to have some kind of follow-up program to watch out for recurrence of a kidney cancer on the second kidney, if you do take the kidney cancer on the first one.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
So pretty much, and now obviously, if you find a cyst or mass, and then you go forward. But if you don't find a mass, or you're not looking for a mass, or you couldn't find a mass because you didn't do any imaging for whatever reason, they typically sometimes present if they are a little bit more advanced with the blood in the urine. So if you find blood in the urine, obviously that's an important sign. Then the doctor or provider should take a picture of the kidney and make sure there's no mass or tumor. Obviously the blood can be from other sources too, like stone in the kidney or infection in the bladder or bladder tumor as well. So the whole urinary system need to be scanned or imaged with a sonogram or CAT scan or MRI, whatever modality is available based on the patient's need. So folks, that was basic information for you folks for the common problem which we see in the clinical practice, cyst or mass on the kidney. I hope this information was useful. And on that note, I call it end of this session for Dr. Fazil Show. I'll be back with more information about more useful topics about your health and other health-related condition next month. Have a nice rest of your month, and God bless you and God bless America. It was Dr. Fazil here. I'm a kidney specialist. Have a nice day. Thank you.